Clinical trials are vital to advancing medical research, allowing scientists, clinicians, and medical professionals to develop and discover new treatments for all types of diseases in a controlled environment. The clinical research process is life-saving.
So building capacity for sub-Saharan African countries by human resource development and infrastructure for data science and clinical research is very crucial, both for countries and the industry. It's very important for the countries because the right data at the right time with the right people means that there is more evidence-based decision-making. More evidence-based decision-making will improve the quality of services delivery at the country level.
It's so important because clinical research, especially through clinical trial, is the best way to gather a high level of evidence that anything that works was not by random chance, it's due to the intervention that you're evaluating.
Clinical research helps to advance the prevention, diagnosis, and treatment of disease. Through clinical research trials, medical professionals lessens the burden of disease. However, there is an increased need for more efficient and curated global health responses to communities worldwide.
The inefficiencies that we have identified, over the course of the last few years specifically have been lack of technology, lack of collaboration amongst clinical research and our outreach to get the treatments to them sooner, quicker, getting into those communities and not so much necessarily having the participant go out to the hospital, but sometimes we have to travel to them.
Better clinical research is possible. A Kigali, Rwanda-based clinical trial site network and site management organization supporting countries in sub-Sahara on capacity building for clinical trial and data science is redesigning the entire workflow of clinical trials through its innovative methodology. Purpose Africa is creating a new way of doing clinical research, establishing an approach and network that is adaptive to not only the research approach, but also the communities it serves.
Purpose Africa is aimed to partner with countries, and we are working with the countries to build their capacity in human resource development and infrastructure for data science and clinical research. We are also partnering with different stakeholders, both at global, regional, and local level, to make sure that there is more data use and also more clinical research coming to the region. So Purpose Africa will be a partner for countries, a partner for stakeholders for a bright future.
By scaling master protocol designs, adaptive trials, and establishing revolutionary new ways of operationalizing trials, Purpose Africa is creating a future where drug approvals and clinical trials are modernized, accessible, and equitable.
The methodology is revolutionary because it allows to evaluate multiple drugs through multiple stages with interim evaluation. This is huge because you are able to gather a quicker answer. The next step is try to get FDA approval and get it right to the patient in a timely fashion and save life.
Ultimately, we are getting out there, we are evaluating areas and regions that do not have a footprint within clinical research. We want to identify primary caregivers or healthcare professionals in these regions. And we want to create training programs in order to expand the resources that can help us execute clinical trials within these regions. We want to be able to develop and identify clinical trial networks in multiple regions around the globe where clinical research is not, there's no footprint.
Enhance clinical research with Purpose Africa. Visit www.purposeafrica.com.